This program has been made possible in part by the following sponsors. The Trial Lawyers Association of BC. The Vancouver Courier newspaper. My new book about addictions, All the Way Home, Building Recovery That Works. It promises to be the biggest court case in Canadian history, and your health care is at stake. This has been going on, the drama leading up to this has been going on for some years now, and we're delighted to have with us in our studios for a second visit, this is show number, I think, 118, Dr. Brian Day from Cambie Surgery Center. And Dr. Brian, you just spell it out for us, because there are some simple facts that people have to know. This is BC Supreme Court, starts September 8th, yes?
Yes.
Okay. Who's suing whom and about what?
Well, there were originally we had 7 plaintiffs who launched suit against the BC government.
Yes.
Our clinic, Cambie Surgery Center, and 6 patients.
Yes.
Sadly, during the long wait to get to trial, 2 of our patients have passed away, cancer patients. But we still have 4 plaintiffs who are patients. And essentially, this is a fight for the right of patients' access to healthcare, which across the country they're not getting.
Yeah, you've said clearly many times that we're at the bottom of the list of Western democracies in terms of the way we deliver health care, that we spend too much money on administrators, and that your notion of adding some private elements not only would not threaten the whole system, but in fact is how many countries operate, and operate much more efficiently and deliver better care.
Well, precisely. We are the only country on earth
Yes.
that makes it unlawful for a citizen to spend their own money to buy health insurance or health care.
I think you should tell the audience how unlawful, because it's not cheap. If I went and did this, theoretically, I could be fined $10,000 for the first offense?
Well, in Ontario, yes.
Yes.
In British Columbia, we have similar laws that have been passed.
Yes.
And signed by the Lieutenant Governor, but not yet proclaimed by the Cabinet. So those are we're under threat of that.
Yes.
And this has already been to court in Quebec, but that was under the Quebec Charter. Even though this is a BC Supreme Court, we will be arguing under the Canadian Charter of Rights, and it will be precedent-setting across the country, and that's why lawyers across the country are calling this the biggest case in Canadian legal history. And
the BC government, in one form or another, has already spent millions lining up its defense.
Yes, in an unprecedented move, they have filed 30 expert reports in this case. These are so-called experts. In fact, as you might imagine, I don't consider them experts.
Yes.
We have counted with 4 experts on the basis that we consider our reports to be at least 7 or 8 times more accurate
yes.
and valid and than theirs. So, in fact, many of the government's expert reports, which this hasn't been realized by government, will actually help us when we dissect them out.
We, in fact, at this stage, Dr. Brian, we actually have a duplicitous kind of system. We like to believe that we have this universal health care and everybody is the same, but in fact, government employees, federal prisoners, some immigrants, workers' compensation, there are all kinds of people who don't have to stick to the queue, who queue jump or get preferential treatment. Is that not so?
Well, what's even more interesting, yes, that's absolutely correct.
Yes.
And one of one of the defendants in our lawsuit, the defendants are the Attorney General of British Columbia, the Minister of Health, and the Medical Services Commission,
Yes.
which operates the medical plan.
And one of these guys actually is
One of
is
the
profiting.
defendants
Yes.
has been, a
Yes.
former Attorney General,
Yes.
and this is in the public domain. I'm not
Yes. Yeah.
disclosing any confidential information here. But Barry Penner, a former
Yes.
Attorney General, went and had private spine surgery at another clinic, not our clinic.
Yes.
And
In
and
Canada?
in British Columbia.
Yes.
In violation, if you like, of the law that the Attorney General is now defending. And this is, we could actually, once this case is all done and over,
Yes.
we could sell it to Monty Python to do a skit on it, because it's so, some of the issues are
Well,
ludicrous.
Monty Python is famous for the Dead Parrots skit,
Yeah.
and we have someone in the BC government who is or has been a veterinarian.
Well, the current Minister of Health is a veterinarian, and
Yes.
you raise an interesting point
Yes.
in that if you were a dog or a cat,
Yes.
it's legal to buy private health insurance in this province.
Yes.
But if you're a human, it's not. So we're fighting basically to give humans the same rights that dogs and cats have, or that Canadians in British Columbia who are not in jail, the same rights as Canadians who are in jail.
So this is what I have to do if I want ready health care. I either have to kill someone or rob a grocery store, or I have to change my name to Bowser and pant a lot.
Well, there's a funny cartoon that
Yes.
was in a newspaper some years ago, and it was
Yes.
on an elderly lady in jail behind bars, and she's being asked what is she there for, and she says, the only way I could get a hip replacement.
Here's a letter to the editor. I don't know if you saw this one, but it's a good one. 1984, Canada adopted reasonable legislation embodied in Canada Health Act. The Act establishes principles of public admin, comprehensiveness, universality, portability, and accessibility. Public administration, this writer says, refers to insurance. It does not refer to delivery. Nowhere in the Canada Health Act does it say healthcare must be delivered in a public institution. Is he right?
He's right, and of course we have done contract work for the BC government hospitals.
Yes.
We are one of the interesting paradoxes, if you like, is our biggest clients,
Yes.
patients. Doctors don't like to call them clients, but
Yes.
are patients injured on the job.
Yes.
And amongst that group, unionized workers are the biggest group.
Yes.
They're the commonest, that's the commonest demographic of someone treated at our clinic is a
course.
unionized worker.
Yes.
And of course, one of our biggest opponents in this case
Is the union.
are the unions. and the one union just a few weeks ago
Yes.
granted $50,000 to an intervener who is intervening against us. So we are literally facing a situation in which a trade union is funding an effort that would stop their own members getting
From getting good service.
It would force them, instead of waiting a couple of weeks, to wait a couple of years.
How do you explain that? How do you understand the unions having this double road heading into a kind of collision?
Well, I think most people would define that as stupidity.
The author of this letter to the editor, who you may or may not know well, is a Dr. Alan Bagoo, CEO, Pacific Orthopedics and Sports Medicine and a clinical instructor at UBC in orthopedics. He goes on to say, where Canada healthcare went off the tracks was in the development of health authorities, which have taken on controlling healthcare, especially hospital-delivered healthcare. He says this represents a conflict of interest because they control both the resources, that is the money, and the delivery of healthcare.
Well, one of the descriptions I use for Canadian healthcare
Yes.
is cryocare.
Cryocare.
Cryocare, because Air Koryo
Yes.
is the North Korean airline, and it's been ranked the worst performing airline on the planet.
Why, the planes drop out of the sky,
Well,
they're always late,
I call
you lose
it-
your baggage, yeah.
They are obviously a monopoly.
Yes.
They're funded by the government.
Yes.
They decide where the services will be, where the airports are. They decide where the planes will be, what kind of planes. They decide what the customers will pay. They decide who will work for them, what they'll pay the workers, and they control every aspect of that airline industry.
And it turns out that they're a terrible service.
And it's a monopoly. And basically what I'm saying is that a monopolistic system where you have control over funding, service, delivery, and outlaw all competition, which is what the Canadian health system does, and particularly the British Columbia health system. When you outlaw all competition, it's like in the media. If the CBC were the only outlet for the media, we wouldn't be getting the same level of service because there'd be no competition. They give you what they felt like when they felt like.
24/7 hockey, regional hockey.
Well, when I was a kid, I was brought up in England where there was only the BBC.
Yeah.
And they had a thing called the interlude, which is where they just went off air for 2 hours every now and then. And an interlude came on the screen because it didn't matter.
There was no explanation.
No, they were the only show in town, and
Must have been good for the pubs, though.
well, it was good for their budget because they were funded the way we fund hospitals here, where we
Yes.
give them this global budget. Doesn't matter how much service they provide, they
Yes.
get the same cash. So, just like the BBC, the less you put into the product, the more you get to keep.
How do you explain this odd divergence? The British Columbia government, for many years now, want to sell off roads. They want to sell off liquor stores. They want to sell off the ferry system. They want to get rid of a ton of things that we've allegedly, we've taken on over the years, and they want to make them no longer public interest, but private concerns, the famous triple P, right? Partnerships, public-private partnerships. Why is it that they're willing to do that, but so unwilling to look at healthcare?
Well, as you know, healthcare conjures up all kinds of emotional attitudes. There are through I believe a process of indoctrination. A lot of people, not the majority by any means, but a lot of people have come to believe that this healthcare system that we have is wonderful. Well,
some
measure,
of it is.
Some of it is. Oh, at its best, it's unequal.
Yeah.
But if you compare it with similar systems, one country, for instance, would be France or Belgium.
Yes.
or Holland, countries, Switzerland, countries that spend the same or less than we do on healthcare and do have competition, both in funding and delivery, outperform us by a wide margin, by a very wide margin. And of course, one of the strategies being used in this legal case is what I call the American bogeyman,
Yes.
say it's either the Canadian system or an American system.
Yes.
Well, I point out that when the World Health Organization ranked our systems number of years ago,
Yes.
we were ranked 30th, and the United States was ranked 37th. So if you were in charge of a hockey team,
Yes.
you would not want to look at the 37th team to compare yourself to. If you wanted to get better, you'd start looking at some of the higher ranked.
And that's not the model you're going for.
No.
All right, we're going to take a little breather here and come back. When we come back, we'll ask Dr. Day to argue about some of the challenges, because so many people, when they hear him speak this way, say, oh, you're just trying to make an extra buck, and that's all this is about. But I believe that's not what it's all about. We'll see. In the meantime, we take a little breather. Your opportunity to say hello to davidberner.com, our website. We always welcome your thoughts. And a chance for those lovely people who sponsor this show to say hello here on Shaw Community Television Cable 4. We'll be back with this healthcare debate in just a moment. This program has been made possible in part by the following sponsors. The Trial Lawyers Association of BC. The Vancouver Courier newspaper. My new book about addictions, All the Way Home, Building Recovery That Works. A lot of different forums for the discussion about how we deliver healthcare service, but one of the strongest and perhaps most important is our Supreme Court system. And the BC Supreme Court, beginning September 8th, will be looking at one of the biggest and most costly arguments in Canadian jurisprudence history, and that is when Dr. Brian Day of Cambie Surgery Centre and a number of plaintiffs are suing for the right to access privately paid for medical services, many of which we already have. I mean, when I go and get blood work or an x-ray, we're paying a private operator and they seem fine to me. I mean, I get timely service. I don't have a big problem with them.
Well, you're absolutely right. In most countries, like the countries I mentioned, the European social democracies, dentistry and drugs are part. Pharmacy is part of the health system.
Yes.
And it makes no sense that they're not part of our system. There is nothing. There is no logic behind the fact that you have to pay for drugs, or if we are in an accident outside this building, we have to pay for the ambulance that picks us up.
Yes, exactly.
That makes no sense. And what Canadians will learn about at our trial is they will receive evidence before the court as to how inefficient our system is, as to how we do have, even though it's an overused phrase sometimes, we do have a bloated bureaucracy. We
11 times in our system, 11 times more administrators, mandarins, and bureaucrats than in a similar healthcare system in Germany.
Yes, and well, the German system is dissimilar in that it has private competition, which we don't,
yes.
And it has no wait lists.
The big fear that so many people have, and you tell me if this is reasonable or not. I understand the fear, but tell me if it matches the reality. Is if we have a system like Germany and there is the public system and some private elements, do not all the best doctors automatically drift towards the private system because they can make a bigger buck? And do we then have a decimated, second-rate, cheesy public system?
Well, again, the evidence when this comes to trial will show that actually government policy stops doctors from treating their patients in this province. We now have the biggest wait lists in the country are in my specialty of orthopedic surgery.
Yes.
We have a large number of unemployed orthopedic surgeons who can't get a job in this province.
Because?
Because the government won't give them work in the public hospitals. So the exact...
I don't get it. Why not?
Because they will use up the hospital's money by treating patients.
Why would you want to do that?
Yeah, exactly. Yes. So this is going to embarrass the government when the facts go before the court. We're actually, we would have preferred politicians to show leadership on this issue. They haven't. So instead, the approach will be that a judge will look at objective evidence on both sides. The government will try with the 30 experts to counter our 4 experts.
Yes.
Our 4 experts, we are confident, will prevail, and the judge will rule that as the Supreme Court of Canada ruled in the Quebec trial, that patients in BC are suffering and dying on wait lists. That's unconstitutional.
2 of your plaintiff patients have died, and 2 of them have had their health seriously compromised.
One of our plaintiffs is a young 16-year-old boy who waited 27 months on the wait list at BC Children's Hospital for spine surgery and has ended up paralyzed for life.
We featured him the last time you were on this program.
And 50% of children at BC Children's are not getting treatment in a medically acceptable period of time. This is This is outrageous for a rich country and a rich province like British Columbia.
The government, you have pointed out that the government will argue that wait lists are not their responsibility. Now, I don't understand that. How can they make that argument? If they run the healthcare system, then all of it is their responsibility, including wait lists.
Well, they claim that the fault is either with patients for
Getting sick?
Well, for not being able to find healthcare quickly, and if it's not with patients, then it's the doctors who are not. For example, there are 200 people waiting for spine surgery at BC Children's. The government would like to blame the doctors for that when those 200 children are all ticking time bombs. We don't know when one of them is going to.
What is the blame of the doctors about? The doctors are playing golf. They're in Cuba. What are they doing?
No, the doctors are supposed to, with their limited OR time, choose which ones are going to go sour, if you like.
I see.
And then they will say that if the doctors aren't to blame, it's the hospital boards for not running the hospitals properly. And of course, the government appoints the hospital boards, appoints and the hospital boards appoint the CEOs of the hospitals. So,
okay, explain this to me. But I got timely service, but there was a peculiarity, of course. The last time I had an unfortunate so-called heart episode, which turned out to be actually a heart attack, when I went in, I was told it was a Friday night, Saturday morning. So I was told, okay, you're having another one of these angina things, and we got to deal with that. But it's now Saturday morning, and the team has looked at you, but normally we don't use the operating theater on the weekend unless there's an emergency. So then you go to your little room praying for someone else's misfortune. In other words, you hope that someone has an emergency so you can be treated. As it happened, there was an emergency. I got my treatment. I was swimming 5 days later. Wonderful. But what is that about? See, I don't understand that. Why don't we have, I'm sure it costs more money, but why don't we have doctors lined up doing these things?
Well, because the government doesn't want to fund that because they would run out of money. They're running such an inefficient show.
Yes.
And this is what we need to come to terms with, that for the amount we spend on healthcare, we should not have long wait lists. For the amount that, your story is not rare. 26%, this was a survey by the Doctors of Canada's newspaper, found that 26% of doctors reported having had a patient die while on a wait list.
One of the most shocking things that you've put forward in your arguments, and you've put this forward many times, is that the people most adversely affected by the inefficiencies of our healthcare system are the poorest. The lowest socioeconomic group in Canada are the people who get the worst healthcare service. Why is that? I don't get that. I would get it if the rich were buying services, but that's not what's happening.
Well, you're exactly right, and that the promise of the so-called Tommy Douglas health system was that those people would be taken care of, and the reality is they're not. As we point.
Why, Brian? I don't get that.
Because the system is clogged up, and the lower socioeconomic groups are least capable of manipulating their way through the quagmire of getting access, and also, which is significant, as you pointed out, we do have private insurance for what are described as non-medically necessary services.
Yes.
But such medically necessary services include drugs and dentistry and
of course
and braces if you need a brace or a splint or an artificial limb if you have an amputation. All of those
accessories, wheelchairs, blah, blah,
all of those things have been arbitrarily, not by doctors, described as not medically necessary, and of course the poor and the socioeconomically disadvantaged don't have that insurance. So we have a two-tier system even on those terms, and there's no question that, and this is always applied, the rich never suffer in any system. So to label this as a rich versus poor is just wrong.
So we've got less than 2 minutes left. September 8th, this circus begins. A, how long do you expect the trial to go on? And B, what's the worst thing that could happen? What's the best thing that could happen?
The trial is scheduled for 18 weeks.
My goodness.
18 weeks. Well, it's a big
Are you
trial.
shutting down your business?
I will not be able to work the way I normally would. And the best thing that can happen is what will happen, and that is the judge will rule, we hope and expect, that BC residents suffering on a wait list will have the same rights under the Charter that the Supreme Court of Canada granted to Quebec residents.
Timely
suffering.
medical care.
Yes.
Which is what's supposed to be. And you're pretty confident that that's going to happen?
I expect that outcome.
Good. I hope so. So, Dr. Bryan, thanks very much. We should point out that you're the former head of the Canadian Medical Association. Very quickly, what percentage of all Canadian doctors agree with you?
83% and 76% of Canadians generally.
Wow. Very good. Okay, thanks. So what are we doing? That's it for today. What are we doing next week? Oh, yes. Next week, very interesting. Brad Salzberg, BC Director of Putting Canada First. I guess this is an immigration story. We'll find out. Thank you for being with us here on Shaw Community Television. Good night.